All right, and Lena, I'll go ahead and turn it over to you to get the webinar started.
Great, thanks, Courtney. Welcome everyone to our webinar today, Staying Well While Working in High-Stress Traumatic Environment. We're thrilled that so many of you had registered to participate in this webinar. I am Lana Schultz, and I've been with the partnership since October. I am co-director of the CARES Act project for the partnership, along with Arlene McAtee, who you'll be hearing from later. She's the other co-director. We have been hard at work looking at the needs of the network to make sure that we are providing services to those who are experiencing poverty. And one of the unmet needs that has risen to the top to do with compassion fatigue, self-care. We've been through a lot, and we know that, I'm hearing that from the agencies, and so we have begun this two-part webinar to be of assistance to, right now, the supervisors and later the staff of these local agencies. And we know that we need this work in order to be able to fulfill our promise. Tiffany, if you want to take it to the next, or I'm sorry, Courtney, if you want to take it. Yeah, so for Beth and Kay, we do have a promise that guides our work in community action. We are about changing people's lives, embodying the spirit of hope, improves communities, and makes America a better place to live. We care about the entire community, and we are dedicated to helping people help themselves and each other. So we're sure that this webinar today is going to help us fulfill that promise that we're called to do. So it's been a pleasure to work with Beth and Kay in preparing this presentation for you today. Both come to this with a lot of experience in the world of working with compassion fatigue and compassion trauma-informed care. Beth is a compassion fatigue specialist. She teaches yoga. Yay! Her experience includes 30 years in the child welfare system as a case manager and a forensic interviewer, and has worked in the public behavioral health system. And Kay is a compassion fatigue specialist, trauma-informed care trainer, and a mindful educator. She also has 30 years of experience in the field as a mental health professional and in the public behavioral health system. She has served on the team for the National Council for Behavioral Health's first national learning community for trauma-informed care. And Kay and Beth are the co-owners of Resiliency. So that, I'll turn it over to you two, and thank you very much for sharing your wisdom with us today.
Thank you. Thank you so much for having us. Welcome to everyone on the webinar today. I'm Kay Glidden. Beth, I think the next slide shows where we're coming from. I am coming to you from Florida. I know we have people all across the country, and I'm coming to you from the East Coast of Florida. That is my condo, and that is my husband.
And hi, I'm Beth Reynolds-Lewis, and I'm coming from right here from this house right upstairs there, except it is not very nice here today in Kearney, Nebraska. We've had about 3 inches of snow. So it's pretty, the lighting's pretty, right, with the Christmas lights, but it's a cold day here. So very excited to be with you all. We love our partners in community action, and we just enjoyed all of you as we've done some training for different groups across the nation.
So Beth and I are real informal trainers, and pre-COVID, we were training with our company called Compassion Resiliency across the country, face-to-face trainings. And then COVID hit, and in April, we started to do webinars, and we thought, okay, well, we'll be doing this for a month, and now we started that in April, and now it's December, and we're still doing webinars. So hopefully, with the vaccine, we will be back into face-to-face trainings. So we're going to start today with a little poem for you. if you can sit quietly after hearing difficult news.
If in financial downturns, you can remain perfectly calm.
If you can see your neighbors travel to these fantastic places without a twinge of jealousy.
If you can happily eat whatever's on your plate.
If you can fall fast asleep after a day of running around without taking a drink or a pill.
If you can find contentment just where you are,
then you are probably a dog, right?
So dogs are so mindful, they just enjoy the moment, right? They're just where they are. And this is our friend Suzanne's dog. And if you lived in Kearney, Nebraska, you'd probably see this dog riding around town like this. Looks like he needs a little cup of coffee right there.
So we're going to start with the webinar with a tool. We aren't talking head presenters. We like to give you tools. We'd like you to try the tools. And we're just going to give you a lot of tools today throughout the webinar. Everything that we mentioned today is in that resource list that we sent you. I'm going to do the meditation, and Beth is going to ring a singing bowl to begin, and she will chime it to end. So I'd like you to just get comfortable and put your feet on the floor, your back, your spine straight, your hands in your lap. And I just want you to start by just doing some normal breathing, inhaling and exhaling. And I want you to notice with curiosity if there's any tension that you might have in your body. You might do some neck rolls. You might lower your shoulders. You might unclench your jaw. Just note with curiosity where there might be some tension. Now I want you to focus on your breathing, just your normal breathing, and note where your breath is most predominant. Is it coming from your nose, your chest, your stomach? And just focus on that area. And you're saying to yourself, inhale and exhale. The reason that we focus on our breath is that because we can only breathe in the present moment. We can't breathe in the past, and we can't breathe in the future. And so we want to focus on our breath because our breath is in the present moment. And so as you're doing that, your mind is going to wander, which is normal. Just look at your thoughts with curiosity and then try to let them go. If you find you're worrying about the past or you're planning for the future, what am I going to have for dinner, lunch, then you're not in the present moment. So just gently bring yourself back. Anchor yourself into the present moment. Meditation is so helpful during the pandemic because it helps reduce our stress and our anxiety and helps us to live in the present moment. May you be healthy, may you be safe, and may you have peace. So just come back gently to the room and open your eyes. And we want to tell you about this Insight Timer app that we both like and use. It's free. It has a series of guided meditations of different lengths, different types of meditation, different speakers. And I use it a lot for sleep meditations. So if you could put in the chat box how that was for you, if it was good, if you hated it, it's okay. If you're overwhelmed right now, then it might have been really hard to do it. And meditation is a practice, and if you aren't into meditation right now, I'd say start with a minute and then work up 2 more minutes.
And I always think about it like conditioning for your brain. You know, if those of you who are walkers or runners or do aerobics or any of that kind of thing, you know that some of your hardest workouts, the ones that make you feel tired and that are hard to do, are probably the most beneficial for your physical and mental well-being. Well, it's the same with meditation. If it feels hard or if you're struggling, it's okay. Give yourself some grace. But it does, every time you're bringing yourself back to the current moment, it is like a mental bicep, like a bicep curl for your brain.
And most of us spend the day, myself included, I'm a mindful instructor, but most of us spend the day with our brain somewhere else and our body somewhere else, right? So if we focus on our breath, which is in the present moment, it helps us to ground in the present moment. So we have a lot to discuss with you today. We want to show you kind of the content of what we will be presenting to your staff, though not in as much detail. So we do want to show you that, which is addresses your individual compassion fatigue. And then we also, at the latter part of today, we want to give you some supervision tools to look at, see if you want to use.
So we're just going to give you a teaser in the first part. So hopefully you'll come back for more with your staff.
So it is a strange and difficult time. We've never been through this pandemic, a pandemic like this before. You're working in the middle of a pandemic during December, which is usually a stressful time with holidays and with it getting dark for a lot of us earlier, the winter time. So it's a lot. It's a lot. We're feeling a hard time balancing everything, and just insecurity of not knowing when it's going to end, loss of safety and security. And that's for the consumers also that you serve. Many of us were already tired before this whole thing began, right? You were probably already exhausted. This is an actual launch from the beach where I live of a SpaceX. We just had one last night too. It was really cool.
So this is called the complex stress model, and we'll go into a little bit more detail when everybody's back on the next time we're together. But here's the idea, is that we have, if you look at the blue, we have systemic workplace stress. So that's just kind of like the everyday, right? The job stress, burnout. Some people might be experiencing some harassment at work. But then on top of that, we have traumatic workplace stress. So our staff or ourselves might have direct trauma, something happening to us directly that's causing emotional trauma, or we might have indirect trauma in the sense that the work we do serving others is really, really hard. So, we experience other people's trauma through listening to their stories and other means, but I think what Kay and I really want to stress with you is jobs are hard, traumatic workplace jobs are even harder, and then we're in the middle of a pandemic. So I feel like there should be another one off to the side, and there's a lot of uncertainty. So we just want to give you this model to kind of go from Dr. Pat Fisher, who we've worked with through the TEND Academy.
Beth, can you go back a second,
yeah.
Please? So the blue is for everybody's job has stress, but you all in the orange, you have even more of a layer of a stress because of the consumers, the people that you serve, they have a lot of traumatic stress. And so that's the reason why we really need to amp up our self-care, because we have not only workplace, but we have the traumatic workplace stress as well. So that's really important to know that we have to include self-care every day. And most of us will come out of the pandemic with post-traumatic growth. Most of us are very resilient, though we have seen a lot of increase in anxiety and depression and loneliness during the pandemic. But most of us will be resilient.
So this is just a little piece about self-care. And when I graduated from the University of Nebraska in Lincoln, my degree was in secondary natural sciences. So I was going to be a science teacher, right? So I have two sides of my brain that are kind of going on. I have the very analytical side of my brain and the very yoga teacher side of my brain. So somehow I had to marry these two together, right? To understand why these self-care practices have been so healing for me. Self-care really is that consistent use of practices or taking actions that reduce the cortisol and the adrenaline in your body. And every time we practice self-care, it increases our serotonin and our dopamine levels. And when those increase, and we know every time they increase, they're more likely to increase again more easily, it brings our brain into balance. And not only our brain, but our whole body. Cortisol and adrenaline can be very easily triggered for most of us, especially most of us who are working in professions where there's a lot of high contact with other living beings, where there's some emotional trauma with those living beings. And so it's just so important. You can't give what you don't have. So if you're not taking care of yourself, how are you going to possibly care for the people that you supervise, the people in your communities, your families? This really is about gaining that sense in your brain. So there's a physiological piece to this too. These, when we talk about the happiness chemicals, we've known this for years, right? We know that certain things make us feel good. But now we have the science behind it because we can do MRIs and PET scans. We know how dopamine works. We know how oxytocin works. And we know how we can access those chemicals, right? Simple things like sun exposure. An endorphin is a painkiller. So laughter, exercise, dark chocolate. Hey, that's a great one.
Yeah, I use that one.
Yeah, so get those out of your desk. This is the Compassion Fatigue Workbook, and this is by Francoise Mathieu. She's a friend and a mentor from Canada that first taught Kay and I about compassion fatigue in Canada. This is the lovely workbook that she wrote years ago. I think it's still available on Amazon, but it's a nice self-paced thing, and it really gives you just kind of that baseline into self-care.
And a lot of organizations are using this as a book study club. So one organization we worked with, they let staff go on work time and review the book, went through the book. They had different leaders take a section each time. And then when the book was over, they still wanted to meet because they still wanted to share what they were doing for self-care. And so it became part of the organizational structure as well.
Yeah. And I think it fits well into those trauma-informed matrices. So if you all are interested in trauma-informed communities, this really can fit in well to it.
So have you ever heard of do more with less and do it faster? Right? We are always being challenged, and especially now during the pandemic. But the part of it that we need to be aware of is that if we do have compassion fatigue or secondary trauma, it is not our fault. We work in a high trauma field, and it is a part of our job. we shouldn't be fired because we have it or say we're crazy. It's just a part of our job.
And I really feel like sometimes it's the unsaid thing at the office. Like people feel like they can't talk about it. I'm weak. I'm inadequate at my job if I talk about how hard this job is. So, people will ask us, what is compassion fatigue? It really is the cost of caring for a living thing that's in emotional pain. And so this is a quote that Kay and I show everywhere we present, just because it is so important. That expectation that you can be immersed in suffering and loss daily and not be touched by it is as unrealistic as thinking you will walk through water without getting your feet wet. So for those of us in the field, or those of, I think, supervisors, this is really hard. I always think of supervisors like they're in a sandwich. So they're getting it from above and they're getting it from their staff, right? They're absorbing those multiple layers of emotional trauma and experiencing compassion fatigue. So if I have staff that don't have signs of compassion fatigue at different times, I start worrying that they aren't doing their jobs, that they aren't getting their feet wet anymore. This is what we call, and we'll go into greater detail with this next time we're all together, but the it must be nice syndrome. And it's really a sign of compassion fatigue. So if somebody is taking leave from your office, how it shows up in the office really can be that, well, she gets to do that. How can she have enough, sick leave? It must be nice. So Kay, anything else you want to do with this one? Save it. It's hard to know what to do this time and what to do next time. And usually we spend the whole day together. So if we were all in the room, we'd have all these different experiences together. One of the other things I wanted to share with you is direct trauma and indirect trauma. So direct trauma is when you're experiencing the emotionally traumatic event. And we know that everybody experiences emotional trauma differently. What might be traumatic to me wouldn't be to Kay, or maybe vice versa. So again, that's when it's happening to you or you're part of that event. Indirect trauma is when you're watching or witnessing the event. Okay, so then you can talk about compassion fatigue and secondary trauma and all these things they're trying to define right now. But one of the things about secondary trauma is you're bearing witness to those stories. Somebody might be sharing with you their emotional trauma, and all of a sudden your heart is racing. So that's really secondary trauma. Now, as part of this, we also experience burnout. And the thing that's different about burnout is it's really directed to where you work. And any job, any profession can experience burnout. But I love that the World Health Organization now says it's a real thing. But we talk about burnout and she's so burned out, they're so burned out. But I want you to know that burnout is truly related to your job. So if I did the same exact thing and worked at a different office, so I had the same duties as a case manager with my current situation as I do with, but I might, if I take this job at the new network, if I can change jobs and that gives me a sense of relief and I'm doing the same thing as I was previously doing, that's really burnout. It's related to your job, not to home, right? To your job. This is just kind of a funny. So don't be calling in exasperated. And we will teach this to your staff too, so heads up.
So in the handouts, you had a checklist of compassion fatigue, secondary trauma, signs and symptoms. And if you did fill it out, we're going to talk about that right now. Most of us in this field have not had this kind of training before, have not had compassion fatigue training. I was a mental health therapist for a number of years, never had it. And when we're talking about this, it's more than your everyday stress. You wake up late, you spill your coffee all over yourself. It's not that kind of daily stress. This is where you or your staff are talking with people that you serve or even colleagues, and they are telling their emotional trauma story, and you just take it on as your own. You become a sponge. And then it has the physical, emotional effects that happen. So we have to learn how to protect ourselves. And if you took the assessment, it was in the last 30 days, either at home or at work. So next slide, please. We're just going to go through some of more signs and symptoms that were not on that assessment. Now, if you checked a lot of the boxes on there, on that assessment, it is a red flag for you. There is something going on. This is something that you need to consider. Oh, wow, I need to do something about this. So physical signs and symptoms, what I want you to do is on that assessment or another piece of paper, I just want you to write if any of these are true for you, because everybody's signs and symptoms are individualized. There's no cookie cutter, approach to this. You have your own signs and symptoms. And one of the first things to know is I'm not in this alone. Many other people that I work with feel this way. And an awareness that I'm having these signs and symptoms, they must be connected back to compassion fatigue, and I need to do something about it. And I need to do something about it right away. Don't wait for your vacation once a year and think that's going to be great and take care of it all. We have to do daily self-care. We have to make it intentional. So physical signs and symptoms, just write down if any of these are true for you. And what happens when we shove stress down, when we swallow it? We get a lot of those ulcers, diverticulitis, colitis. So just write down other physical signs and symptoms. And they show up first. Those are the ones we tend to ignore. I get the backache right in between my shoulders, the headache. We tend to ignore them. And then what happens? I can tell you. I can tell you what happens because it happened to me. I was a single mom with 3 children. They're all lovely people now. They're all older and moved out. But at the time, they were all 3 teenagers and all having behavioral health crisis. And so I suffered compassion fatigue at home, but at work, I was great. I had support. So what happened to me is at age 50 and 53, I had hip replacements on both, double hip replacements, because I was taking all this in and it was coming out through my hips.
And, I would say maybe 5-10 years ago, people would have said, there's no way. But that adrenaline and cortisol now, we know how hard that is on the organs in your body. And one of the organs of your body is your bones. And so it does cause this chemical reaction in every organ, including your bones. And so we know how hard these high stress environments are and this trauma exposure is on people's physical well-being as well as their emotional and mental well-being.
So how does it look like? What does it look like for you? Did you used to come home for a glass of wine after work and now it looks like this?
Are you having Betty White?
The Betty White special. Or do you I used to just isolate myself. Are you going to work and you're just playing trivia crack all day? What does it look like for you behaviorally? Next slide. Next slide. And then finally, psychologically, what does it look like? Do you feel yourself detached? Do you find you're minimizing or dismissing your suffering? Are you having flashbacks? Are you dreaming and you're not even in your own dreams anymore? You're dreaming about trauma, emotional trauma that you've had with your staff or with the people that you serve.
And it surprises me as we travel across the country, the stories we hear that people, I mean, typically if we were all in a group, somebody in the group would be like, oh my gosh, I never put this together. Doesn't it kind of surprise you still, Kay? How, like, the stories people share with us, and they're just amazed.
Me texting my boss, are we still on for today? Boss, yes, you don't need to text me this every morning. We are still on for work every day, Monday through Friday.
And this is in my text, okay?
Do you want to get this text, bosses online on here today? Here's some more. Write them down if they're true for you. We hear a lot of this in the field, grandiosity, that if I don't do it, nobody can. Nobody will do it but me. And I can only do it. I can only be the one to help this family. And then the last bullet, in the next webinar, we're going to really talk about how do you separate personal and professional lives, and can you do it, and how can you do it, and give people some ideas on that.
It really is a skill. It's something we need to be doing ourselves and training our staff to do.
Now we're going to run through these tools quickly because we want to spend more time with you on the supervision tools. But this is going to show you what we are talking with your staff about. These 10 tools. Now we want to give people tools that when we say self-care, people turn off sometimes because they say, well, that means, you know, a bubble bath and margaritas. And we say, okay, yes, that can be that, but really we're going to try to give you some new tools that maybe you haven't tried before, some new skills, some new tools to look at. So this is the first one.
So when we talk about provider resilience, there's an evidence-based, very well-researched, it's called the Professional Quality of Life Survey, and it is on your resources that you've been given. It's free. You can go online. It's going to measure your compassion fatigue, and you want that number low. Your burnout, you want that number low, and your compassion satisfaction, which I think is really lovely. So we want that number, of course, high. Now, there is an app called the Provider Resilience app. It's kind of geared to therapists, but you could make it, anybody could take it and be like, oh, okay, I see how this applies to me. But it automatically gives you a score. And what we'll share with your staff, too, and share with you is the idea that take it now, put some of these tools in place, and then come back and try to take it again. See if your score is improving. It's 21 questions, takes about 5 minutes.
So grounding is another tool, and it is not a relaxation exercise. It is an active strategy for distraction and connection. Next slide, please. We would use it if we're feeling emotional pain, or we're starting to have anxiety, or starting to feel a panic attack coming on. While we're listening to emotional, traumatic stories, if I want to feel sharp and focused, or if I'm feeling confused or overwhelmed. This is me on the interstate in Florida.
Yeah.
Ice work. If any of you have driven on the interstate in Florida, you know what I'm talking about.
Our interstate in Nebraska is just a bunch of semis and corn trucks, and it's kind of a nightmare in its own way.
Yeah. So mental grounding is one type of grounding. There's mental grounding, soothing grounding, and physical grounding. And we're just going to talk about mental grounding. And I'm going to put you through one of the 5 senses exercise right now. So what I want you to do is just take a deep breath and exhale. And I want you to just look around where you're sitting and identify 5 things that you can see. You don't have to say them out loud. You don't have to write them down. Just look around the room and identify 5 things you can see. 4 things you can feel. 3 things that you can hear. 2 things that you can smell. And 1 thing you can taste. And what does that do if you're starting to feel anxious, you're starting to feel like you're going to getting a panic attack? What does that do for you? It puts you into the present moment, so you're not thinking about what is making you feel anxious. We teach this everywhere. We teach this to youth, adults. We teach it to high school students, kids. I use this when I'm starting to feel anxious. So if I'm sitting in the dentist chair, I may do this. Nobody has to know you're doing it.
I was doing this before I joined the webinar today because I could not get WebEx installed on my laptop, and I was starting to panic. But it really does help. I tell you, practice it a few times. So then when you need it, like I did, because it helps me, I do it, and then I can focus in on the task at hand, right? So it helps you be more alert, more in the present moment. It's a great tool.
Next tool is mindfulness, and this is a great book. If you have not really gotten into mindfulness, it's a great starter book by Dan Harris, the ABC reporter. And mindfulness means paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. Jon Kabat-Zinn is the kind of the guru of mindfulness in the United States. Excellent books, excellent YouTube videos. And for a while during the pandemic, he was doing a daily meditation, which I did get on quite a bit to listen to that. But Beth and I are both mindfulness instructors, and we go into the elementary schools and teach mindfulness curriculum to the students. And then we also teach it to adults. Have you ever had a snack-accident where you're sitting, watching a movie, and all of a sudden you have a bag of chips and you look over and they're gone, right? That's a snack-accident.
I had that interaction with a bag of almond M&Ms last night.
So I said, I am a mindfulness instructor. Am I perfect? No, I am not. Some days I amaze myself. Other days I look for my phone while I'm holding it, which I have done. This is also a picture of one of our staff persons who came to work with two different sandals on. And one day I decided I wanted a salad for lunch, so I came home, I fixed my salad, and I put some croutons on top of my salad. And those croutons were those dog treats. And yes, I did. I ate them and for quite a while until I realized those aren't croutons.
Those aren't burger minis.
So mindfulness takes practice. It really does, because as I said, our mind and our body are not connected a lot during the day. This is how mindfulness can help. It can help because it can put a space between how we want to react, all right? So let's say I'm in line in Starbucks, pre-COVID, I'm in line, and somebody cuts me off, cuts in front of me. What am I going to do? Usually I'm just going to yell or be passive-aggressive or, get angry. And if I'm using mindfulness, I can choose how I want to react. I can think about how I want to respond. I can feel my body responding if I'm getting angry, upset, and I can then choose how I want to respond. Do I want to respond? So that cortisol doesn't kick in and that adrenaline doesn't kick in.
I think the great piece about mindfulness, too, and how we sell it to high schoolers and young adults, college students, is just that idea. I always ask them, who in this room has never sent a text message or said something to someone that they wish they wouldn't have said, right? So mindfulness really helps us. It's kind of that preventative buffer to help us be sure of our communication and our actions.
These are just some apps that we have used and liked. Most of them are free. Some of them have a component of you can buy more things in there, but we like to promote free things. But if you have any apps that you're using for mindfulness and meditation, if you could put that in the chat room for everybody to see that you like.
That would be great. So this next tool is one we'll be teaching your staff. And so it's really important that you all have the same language. And at first when you look at it, you might be like, well, that's really complicated. It's really not. It's really easy. You just need to talk about it a little bit to get it down. So it's low impact debriefing. It's like letting the steam off the pot a little bit. So after, and it can be anything that has happened in your office or in somebody's personal life or whatever, one of those things that's really bothering you, it's keeping you up at night. And the way we like to share it is simply by giving you these 4 steps where everybody has self-awareness, everybody knows the tool. We make sure, if I'm the one sharing the information, that I give fair warning, right? The way you give fair warning is just to say, I'll give you an example with Kay. Hey, Kay, I have something that I need to talk to you about. It's really been bothering me. I saw something happen to a dog. And
okay.
I'm going to listen for her consent.
Okay, yeah, let's go back to my office so we can talk about it.
Right. So taking it out of the waiting room or taking it away from little ears at home or other people who maybe don't need to hear this story. Maybe it's health information we're sharing about somebody we're serving. And then I'm going to give a limited disclosure. There's no proof that shows the more detailed, the more graphic I am about what happened to the dog, the more debriefed I feel. So it's just training everybody to use this tool. When your office is, when everybody was in the same work site, did you ever walk in and it's just like a green fog in the office? And more than likely somebody was sharing, trying to debrief, not using this tool, and so they were sharing some graphic information.
And the debriefing tool is a peer-to-peer debriefing tool. It's not meant for supervisors to peers. So for you all supervisors, you reaching out to other supervisors. This is just a little funny.
That's how I'm feeling it.
We're always good at telling others, how to take care of themselves, right?
So this next tool is actually called Hot Walk and Talk. And it's also from Dr. Patricia Fisher from TEND. But the idea is, let's say Kay has witnessed something in our parking lot, right? And it was pretty graphic. Maybe somebody that we were serving is really upset. And so they started yelling or screaming. They were really frustrated. So what I would do is I'd grab Kay and I would say, let's do a hot walk and talk. Kay and I would walk as fast as we could, right? And I would give her as much water as she could possibly drink. And the idea behind that is the faster we walk, the more her physiological system is working out that adrenaline and cortisol. The water is helping flush the adrenal glands on the back of our kidneys, also getting rid of those chemicals. Now, while we're talking, I'm going to ask her, tell me how it started, tell me what happened next, and tell me how it ended. And I'm going to keep emphasizing how it ended. Okay, good. And we're going to do this as many times as we need to while we continue to walk and drink water until she can say, I'm feeling a little better. My heart's not racing anymore. What we found happens is people take what happened at the office. We do a lot of training for like nurses and healthcare staff also. Have you ever seen a doctor just eat a nurse's bacon in front of people? So this is that idea that they don't have to take that home with them. We don't want that staying in your body and doing physiological damage. So this is a process in getting that what's weighing heavy on their shoulders processed through their body physiologically and emotionally.
So nature is another tool sometimes we take for granted. How many hours do you think, just put in the chat box, how many hours per month does research show that you need to be in nature? Okay, I wish we had a big prize for the winner of this, but.
Oh, there's no prize?
It's 5 hours. That's all. So you can do way more than 5 and just think of the benefits that you're getting, especially now during the pandemic, how important it is to go outside. And a lot of these tools that we're giving you is hopefully some that you can not wait till you get home. You can use them during work time.
Absolutely. Just taking a break. Get outside for just a little bit. Let's see. Oh, this cartoon actually came from the Omaha World Herald. It's a great cartoon just reminding us, our smartphones are kind of becoming part of our body, an essential organ, and how connected those are. When you think about somebody holding it, you don't think about the connection to your brain, how immediately they can be all full of adrenaline and cortisol, and you can immerse yourself in this stuff all day if you choose to.
These are two good books that we like and recommend.
Yeah.
They're on your resource list.
I was just going to say, Kay and I aren't selling books, but we're both really big readers, so we like to share what we've read.
Positive support, just to put that in terms of not a lot of us like, and myself included, like to have the venting groups, the negative groups, the bitching groups, and research shows that that is not as helpful as the positive support. The positive support, the coworkers that feed our energy with positivity, helps our resiliency.
This is just another tool. I don't know how expensive it is. For a while, it was getting kind of pricey, but it is a very well-researched tool. It's a biofeedback thing that you can install on your laptop or your iPhone. And what it's doing is it's measuring the covalence between your heart, and your breath. Now, if we all take a moment and imagine you're going to go into a meeting that you're just dreading, right? Who hasn't been there where your heart's just like, ooh, and you're holding your breath. You can't even get a breath out. So heart math makes us start recognizing through the screen, it looks like this, the idea that I'm holding my breath and my heart is racing. So the more you recognize that, you can see it in front of you, you're like, oh, okay. Then you get how to bring it back down, how to bring it into covalence. And one of the things they found out through all this research is somebody can look like this, right, as soon as they get the little clip on their ear. But as soon as they start thinking about appreciation, the mind-body connection, their heart rate starts to slow down and they start taking full breaths. So they start reaching that covalence that's so important to all of us. And it's amazing the stuff we know about this now. So it's a great tool. These are two fabulous books. So I told you I was a science teacher, right? But then I'm a yogi teacher, teach yoga. So I have this very tree huggery side of me. And so I couldn't figure out why this was helping me. In my past life, I had a lot of vicarious trauma. I served children and interviewed children and some adults who were the victims of all kinds of horrendous things, right? And I would carry those stories home with me, and they took a toll. So I decided at the age of 50, seems like a long time ago, well, it kind of was, to go get my yoga certification as a teacher. And I was just amazed about how much it helped me. I didn't really understand why, but these two books show you or talk to you about the mind-body connection that Kay and I have been saying, how emotional traumas and vicarious trauma and compassion fatigue can be so hard on us, not only emotionally, but physically. So this is a pose that I call legs up the wall. And if we were all together, we would be doing some of these things. Probably not this one. But I did this with some participants at a conference that we're giving. And the idea is you scoot your rear end as close to the wall as you can get. So scoot your rear end, your tailbone as close to the wall as you can get, and to gently slide your legs up the wall. And it's going to be a huge quad stretch for you. It's going to stretch your lower back. If it's too intense or this causes any pain at all, pull yourself away from the wall a little bit. Bend your knees. Maybe support your knees on another chair or an ottoman, your calves and knees. It shouldn't be painful, but the idea is we're just laying there. We're totally supported by the floor and the wall, right? When I teach intensive outpatient for some drug alcohol programs here in Kearney, this is one that the participants love in that class because they become mindful of their breath. They feel what it's like to be, there's so many things in our lives that are so unsupported. This is a way to feel supported, physically, emotionally, and mentally.
So if you look back on those 10 tools, could you write in the chat box with ones that you are interested in, ones that you might try for yourself, for your staff? Could you just share some ideas that you're thinking about that you might try?
And I think it's easy for all of us to say, oh, this would be really good for my staff person, Janie. You know, it's a little harder to look at yourself and say, oh.
But as a supervisor, you know, you could implement the low impact debriefing. You could implement the walk and talk at work, the compassion fatigue. You could do a work group just for compassion fatigue. You know, what are you thinking about? Just put in the chat room some things. Legs up the wall they liked.
And that's what, that legs up the wall is what in yoga land we would call a restorative pose. So it's good when you need to relax, right? Maybe before you go to bed. I've seen people do it on their, you know, lay in bed, put their legs up on the headboard.
Somebody liked the five senses grounding. All right, great. So now we're going to move on for the remaining of the webinar. We're going to just give you some ideas for supervision tools. And just like the other individual tools, you take what you like, you try what you want. With Beth and I, we always are trying new tools. When we were traveling, that would be our thing. We'd always, wherever we were, we would try something new wherever we go. Because it helps, you know, make it interesting, keeps you sustained, and helps your resiliency. So these are some supervision tools that we're going to go over. The secondary, do you want to go ahead, Beth?
No, I was just going to say the Secondary Traumatic Stress Network, great website, tons of information. You can really go down the rabbit hole there on information about secondary traumatic stress. But one of the great things, too, is there's a supervisory assessment on there that's really pretty good that you can take yourself.
And that assessment measures your secondary stress in the workplace. And Ginny Spring is the instructor there in Kentucky. And she just got a multi-million-dollar grant to help organizations implement this instrument. So if you're really into this and interested, contact at this website.
Yeah. They're doing so much research at the University of Kentucky regarding this. I think it's amazing. They're doing really good work.
So this is a one-to-one meeting form that Beth and I used when we were supervisors. We worked at the same place for many years. And we had to meet when I was a supervisor. I met with my staff once a month. I didn't, not for case management, that was separate. So this was just a one-on-one meeting to talk about these subjects. And if you see here on the left side of the form, at the last question, it asks, how is your level of compassion fatigue, vicarious trauma right now? What strategies are you utilizing for self-care? And it also asks about vacation. You know, are you using all your vacation? What are your plans for coverage so you're not taking your cell phone on vacation? So it's built into the supervision.
And I think this form kind of came about from becoming a trauma-informed workplace, too, was part of it, because we had staff telling us they were so stressed out. But then that next step is, what are you doing about it? because as a supervisor, you can't fix this for people. You can't fix it for yourself, but you can role model it for people. And I think that's an important piece of it. The other piece is when we go out and, let's say we're doing a big hospital system. Sometimes we'll have like the workforce that says, we really want you guys to come in, but the money people are saying no. This idea about managing, really looking at people's vacation leave and sick leave, we know that as sick leave goes up, as people are dissatisfied with their positions typically. So if you aren't happy in your work, then you aren't giving good customer service, and hospitals really have that figured out. And so it makes sense to them now to have trainings like Kay and I give throughout their system to help their staff stay healthy at work.
Beth and I worked for a supervisor who said during a management meeting, I noticed that a lot of you are sending me your vacation slips, to take vacation. And she said, I'd like to know how you have time to do that, because I don't.
We're all like,
And we're like, well, what does that say then? That's the role modeling piece. Like, if she's never going to take vacation, I guess it's not okay for us. And role modeling is really important. You can implement all of this, but if you're not doing it, the staff will know. They watch you like hawks, and they know if you're not role modeling all of this, then they're not going to buy into it.
Yeah. And that's from the very top of the organization down. If you're answering emails in the middle of the night or sending emails, please stop. I mean, I know it's hard. I get it. I work in the emergency system, and sometimes it's just so tempting just so you have that in your brain. But please be mindful of that.
So this is an example of affirmation notes, positive affirmation notes that were left by staff, just Post-it notes. And if you need one, you take one, and you put one back. The next slide shows another example of this. This was 2019. Can you imagine? It'd probably be really different now for 2020. But take what you need. Forgiveness, patience, compassion.
We actually did, through part of the COVID disaster response for behavioral health team that I work for, they took this out to one of our smaller schools that was still in session. As part of the mental wellness for students, they had an opportunity to write on this affirmation wall we made so they could see it every day. So it would be great if your staff are coming back into the office. The vaccine comes out and everybody's going to be back together. Wouldn't this be a cool thing?
I actually think this was at Iowa Community Action.
Oh, yeah. I bet you're right.
So Iowa. This is an example of environmentally how you can implement trauma-informed care, taking care of self. This was originally a institutional-style conference room, with the what are those, the lighting, what's that called, fluorescent lighting, and the table in the middle and the chairs. And they used it for meetings with consumers, but also with staff. It was real boring. So they decided to put in comfortable chairs, some, warm colors, signage, positive signage, blankets. One of those chairs, one of those things on the couch has a massage unit in it. And it was for staff to use and also for meetings with consumers. And a case manager told me she had a meeting in there and with a family. And one of the little girls came up to her after the meeting and said, "Can you show me your bedroom now?" Because she thought it was her home. It felt so comfortable.
Now, I'm going to share a little bit about this because as you all dive into this world, sometimes there can be some people in the office who just are like, do you remember when we did this, Kay? They're like, "You're giving up one of our conference rooms to make a place for so-and-so to sit all day." So it's really about helping. We have to educate everyone in the office about why this is so important, right? That's probably the first step. What you all are doing right now is beautiful because this is a multi-step process to help get staff and supervisors and administrators on the same page about why this self-care and this awareness is so important to the health of their staff, to the health of the organization, and to the health of the people they serve. So, I know sometimes when people look at these slides, they're like, oh my gosh, I can't believe. But seriously, it's one step. It seems like an easy step, but sometimes you can get negative feedback about it.
This is coming from Columbia University, talking about leadership during COVID and how you all have an opportunity to help shape the response. And these are just important things you're probably already doing, but it's so important to, example, communicate, talking about reminding staff of if you have EAP or promoting modeling self-care, keeping the communication going. I know some of you are working from home, but probably a lot of you are working at the office or a hybrid of both. So again, mental health is an issue during the pandemic, and it will be an issue following it because we know, again, depression, anxiety, suicide, loneliness is all up. Domestic violence, child abuse. So we know that your staff will be experiencing that, but also when they're working with their families. So how do you keep employees engaged during COVID? These are just some different ideas. Staff taking turns leading a self-care activity, blocking out, a time where, I'm going to lead a cooking show, for example. Do you want to host a virtual holiday event? Maybe they don't want one. Maybe the thought of getting on another Zoom thing is the last thing they want to do. So asking them, do you want to do something for a holiday? Another organization had a self-care challenge where they actually had a calendar and they chose how many days they wanted to commit, and then they write it down, and then they put it in a pool to win a prize. Ending virtual meetings 5 to 10 minutes early, so encouraging people, okay, we're going to end this meeting 10 minutes early, so go outside, take a deep breath, do some mindful exercises, so that, there's a break and between those virtual meetings, because Zoom exhaustion is a real thing. And even some bosses are saying to people, supervisors are saying, don't put 8 hours of virtual meetings during the day. Don't build your schedule like that. So some staff are offering, supervisors are offering Be Well check-in sessions, coordinated coffee breaks with staff.
All these are super important, I feel like, because you can pack, you can just, I feel like especially on the supervisor level and up in administration, you can pack those meetings in minutes because you never have to leave a room, right? So why build in time to go to the bathroom when you can get another Zoom meeting? So it really, really is important. It's important to your health, and it's important for your staff to see you modeling this out.
This show is boring, boss. Again, this is a Zoom conference. So a hospital, and I can't remember the name of it, Beth, we watched it on Netflix. They did a morning huddle. It was a hospital staff. They would always do a morning huddle and end with some gratitude, promoting EAP all the time, end meetings, sharing some gratitude or joy, hosting an online book club, asking staff, what do they need right now? You might want to have them set aside time in their schedule to do some spring cleaning with their computer, the digital stuff, and encourage staff to engage in professional development and then build discussion around this. So your handouts, you have some organizational strategies for addressing compassion fatigue and compassion fatigue resources. And then this little graphic is just something that I really like because we're also into making sure our phone is charged, right? You know, we panic if we see that red bar. But how, you know, do you do that for yourself during the day? And again, it's so important to put some sort of resiliency, self-care things in your daily schedule, not just waiting until you get home or on the weekends. But doing it during the day is important as well. So at this point in the presentation, you're probably saying, okay, I've heard all this crap before, it's nothing new, but we hope you did find some new tools to use. The part about it is that, yes, you have heard of self-care before, but how many of us do it and do it intentionally? Put it into our schedule and do it intentionally. That's the key. And trying new things. So we want you to make a commitment to yourself based on the things that you've heard during this webinar. What are some things that you can take, again, either organizationally as a supervisor or personally or both? If you could just put some things in the chat, anything that you maybe try a book or an app, try meditation. If you could just share some of the things you might want to try. And again, when we talk with your staff, we're going to go in through these individual tools with more detail. And for example, Beth will be doing some mindful movements with them that they can use during work, at work. Anybody want to share? Be well check-in sessions. Get this training to my staff as soon as possible. Yes, we know it's been very hard on your staff through this pandemic, and then December 31st, you have a possibility of services shutting down. It's very stressful. Somebody's going to try Headspace.
Good.
Stop doing Zoom to Zoom.
I think it's such a challenging time. I wish we were all in the room together with your staff, because then we can really put some of these things in practice as a group and have a lot of practice discussions around them. There's a lot of tools that can really help people. So I'm glad you guys are looking at a few.
Someone says they're going to model this behavior.
Ooh, good.
Okay, next slide, please. Okay, if you are able to believe in Santa Claus for 8 years, you can believe in yourself for like 5 minutes, right? And one time we showed this and someone said, what do you mean, believe in Santa Claus? I still believe. And that's okay. You can still believe.
We all do.
Yes. Okay, so I want you to think about the 3 most important people in your life. All right, you've got those names in your head? Okay. I want you to raise your hands high if you chose yourself. Okay? Now, I know you're not raising your hand right now. And people, we just spent an hour and a half talking about self-care and how important it is. And it's not selfish to take care of yourself, because if you can't take care of yourself, you can't be the best role model for your staff. So we hope that you will consider putting into place some of these tools. Here's a very simple thing that you could post on your computer to ask yourself every day, am I hydrated? Many of us are not hydrated enough. Have I moved and stretched my body? We're only supposed to sit 20 minutes at a time at our computer and a seat. We have to get up and move around. Have I connected with someone? And what are 3 things I feel grateful for? And self-care is not a waste of time. Self-care makes the use of your time more sustainable. This is our contact information if you would like to get a hold of us. And this is our website where we have a lot of materials, a lot of handouts, a lot of resources, and you can download all of them for free. Beth and I have been doing a lot of coping through COVID webinars. We're on part 16 right now. And we have a lot of resources. We have a slideshow of what people are doing to cope during COVID. Some of the pictures are community action staff. So if you want to send us any of your pictures, we'd love to have them of what you're doing to cope through COVID.
And these coping through COVID webinars have been kind of fun just because they aren't recorded. So I feel like you all are my friends. Like we've connected with some of the states that we've been doing this, or some of the networks we've been doing this with. And so as we go across, it's just a great opportunity to share and to have some good discussions and some laughs about how we're all hanging through this together. So thank you all, and thank you all for being such great people. You do such good work, and Kay and I were honored to have this opportunity. So thank you for spending your Friday afternoon with us.
So Courtney did put in the chat room and quick evaluation on SurveyMonkey. It's only 3 questions, and we'd really appreciate your feedback today. Does anybody have any questions? I'm not seeing any Arlene yet.
Yeah. One question that was mentioned earlier in the chat, sent directly to me, it was about whether you all could just clarify, with the next session you referred to that's coming up on January 27th, is the intent that the supervisors would attend with the employees for that webinar?
I think if you do, I think it shows that you really value the topic and that you're going to support them. You don't have to, but I think it would be awesome. We're going to cover that middle section of those individual strategies, and we're going to tell them that many of you all were on this webinar, and that you are looking at these tools. But I think the more support you can give staff, the better. And that's why we wanted to include you first as supervisors, because we've gone to places where the supervisors don't attend any of these sessions, and then the staff say to us, well, my supervisor doesn't support this, so how can I do this? I work in a toxic work environment, and my supervisor doesn't care about me, or doesn't role model this, or doesn't implement anything. And this way it shows that you're being very supportive, and you're gonna work with them on trying to help build in some of these things into the workplace. And a lot of things on that organizational strategy list is free. A lot of them don't cost anything. There's strategies that you can just implement, like the affirmation wall doesn't really cost any money.
I don't minimize your impact as a supervisor. Really empower yourself, because you have a huge impact, and it is one with great ripple effect, right? So I just empower you to think of it that way.
That you would like to take this last opportunity to ask Beth or Kay before we move on out of the presentation? Okay. Well, thank you, Beth and Kay. This was wonderful. This was a presentation that gave us both concepts and ideas, but also concrete tools, and I think that's what we want right now. As a supervisor who's working in a very challenging time, you need both of those things to share with your staff. And the notion that they will be able to align what they've learned with what their staff learns January 27th is a wonderful opportunity overall. So they'll have a chance to think about it themselves and then bring their staff in. So thank you so much for sharing your wisdom and experience with us. It's been a wonderful webinar.
Thank you all.
So we're going to remind you of a couple of things. Courtney, if you could move to the next slide, if you're able to do that. We are going to have a follow-up. We're going to tell you this one more time. To the session we had today, we will have Beth and Kay back, and they're going to talk directly with the staff who are working in the field with families. So this gives them the opportunity to hear much of what you heard today, but to focus on that self-care piece that was in the middle of this, and give you an opportunity to bring a common way to talk about the stress and the trauma that they're dealing with, and a common way to talk about the solutions that you might pursue as an agency and a team. And the next slide. We also want to put in a plug for the National Community Action Partnership Management and Leadership Training, which is not that far away now, February 3rd through 5th. It will be virtual this year, and the registration, I believe, will be open by next week. So please take a look at the 2 to 3 days of very good content that I think is appropriate for the environment we're in and the work we're trying to do right now. And if we go further, if you have information or questions about the webinars that we're offering, or in general as it relates to your agency's efforts to work through the pandemic, please feel free to contact the people you see on the slide here. Erin is the vice president who's in charge of the CARES work. And as Lena said earlier, Lena and I are the co-project directors. So if you would like to get any more information about that work, or if you have ideas about other kinds of webinars and training that would be helpful to you in this environment that we find ourselves in, please feel free to contact us and let us know that. Now, in the spirit of what we were told by Kay and Beth, we're going to give you 10 minutes out of the session that you might have had scheduled. So take a walk, get a good breath of air, think about your plans for the weekend, and we look forward to working with all of you again.